Many of you are probably familiar with OCD, or Obsessive Compulsive Disorder. So then what is OCPD, or Obsessive Compulsive Personality Disorder? Learn about the symptoms and some interventions for OT practice. Hi, my name is Jeff and I am an occupational therapist. I make occupational therapy content on my blog, ot.dude.com, social media, podcasts, and here on YouTube. If you are interested in learning more about what occupational therapists do, be sure to subscribe to my channel so that you don't miss a single video. Also, check out my free resources in the description below. Let's get functional. OCPD is believed to occur in less than 8% of the population, but is one of the most prevalent of personality disorders that's not well known or understood. I have known someone with OCPD for over 20 years, and even I did not suspect it was OCPD, but some other condition instead, because I didn't know what OCPD was. First, let's get OCD out of the way. OCD stands for Obsessive Compulsive Disorder. Obsession is a recurring thought about something. Compulsion is the need to act on these thoughts. You may have watched the TV show Monk and seen some of these behaviors, such as excessive hand washing. OCPD has similar behaviors, but is different in some ways. Clients with OCD have obsessions which are repetitive, unwanted, intrusive thoughts that cause anxiety. They also have compulsions, which are ritualistic behaviors that they feel they must do to control their obsessions. Clients with OCD are often distressed by their lack of control over compulsive drives. In clients with OCPD, or Obsessive Compulsive Personality Disorder, the need for control is driven by their preoccupation with order, so their behavior, value, and feelings are acceptable and consistent with their identity. People with OCD often feel distressed by the nature of their behaviors or thoughts, even if they are unable to control them. People with OCPD, however, typically believe that their actions have an aim and a purpose. With that out of the way, let's focus on OCPD. First, let's define it. Obsessive Compulsive Personality Disorder is characterized by a pervasive preoccupation with orderliness, perfectionism, and control, with no room for flexibility really, that ultimately slows or interferes with completing a task. To be diagnosed with OCPD, the DSM requires that a client exhibit 4 of the 8 criteria. These criteria are 1. Excessive devotion to work at the expense of family or friends. 2. Extreme need for perfection and relentless control over your environment and interpersonal relationships. 3. Inability to be generous to others. 4. Inability to delegate tasks. 5. Inability to get rid of worn out or worthless items, even those without sentimental value. 6. Over-conscientiousness. 7. Preoccupation with details, rules, lists, and order, which can result in missing the major objective of an activity. 8. Rigidity and inflexibility with regards to morals, ethics, values, and/or the adherence to rules. Do you know anyone who has some of these personality traits? Now let's go over some symptoms to paint a picture of someone with OCPD. They often 1. Act restrained or restricted with their emotions. 2. Adhere to rules in an inflexible, rigid way. 3. Create order and lists for tasks. 4. Desire to control their relationship with others. 5. Have difficulty empathizing with others and/or maintaining intimate relationships. 6. Have extreme dedication to their work. 7. Have trouble giving things to others, i.e. hoarding. 8. Have a need for perfection, even the smallest details. 9. Have problems with self-identity and/or self-direction. And 10. Have trouble giving up control and delegating tasks. So you may be wondering, what is the cause of OCPD? Researchers don't really know definitively. Some believe it is caused by childhood experience with overprotective parents that were not as caring, immature emotional and empathy development, and inability to develop secure attachment with their parents. Nature versus nurture, or nature and nurture, right? There may be a biological component to OCPD. If one of your relatives has OCPD, you are more likely to have it then compared to someone who has a family that has no OCPD. So you can imagine living with someone who has OCPD can be very, very difficult. They often believe they and their perception are right, and you and everyone else's way is wrong. Very black and white. In general, we all need to feel a sense of control. Perhaps their way of feeling control is acting on things such as lists, minute details in their environment, or schedules. They can be very rigid in their thinking and unwilling to compromise. they may have a low threshold for criticism and get hurt emotionally very easily. At the same time, they often judge everyone else based on their own perfectionistic standards. Over a long term, this can have negative effects on those around them due to friction between their beliefs and behaviors compared to what is normal. What can be even more difficult is that they are willing to lose anything as they cannot overcome their obsessiveness. Although those with OCPD may suspect something is different about them, they may not seek help because they believe they are right and everyone else is wrong. Let's talk about treatment. Some research attributes management to medications such as SSRIs, meditation, relaxation, stress management, self-care, understanding the condition, psychotherapy, and even CBT or cognitive behavioral therapy. So, what should an OT working with a client who has OCPD or even OCD do? First is to understand their symptoms and personality traits in an empathetic and non-judgmental way. OTs often are patient already with their clients, but working with clients who have OCPD will really challenge your patience. Some areas to address are, of course, ADLs. They often do not have trouble in this area particularly, but it may be affected due to the need to address other things such as messes in the environment, leading up to delayed self-care. Address the IADLs that are outside of their comfort zone. Address leisure and pursuing interests for self-care, relaxation, and stress management. As they may follow schedules, consider scheduling leisure and these activities into their day. Clients with OCPD may be perfectionists, but also have difficulty holding jobs for long times. One study demonstrated in those with OCPD a relationship of overworking leading to burnout. Social and intimate relationships often are impacted because family members or those around them may or may not suspect or understand OCPD. It is important to educate all stakeholders, including the client, about the disorder. Referral to other resources such as LMFTs, counseling, or psychiatrists may help. Consider supporting their use of medications and staying on them. If you get the opportunity to work with a client in their natural environment, such as their home, then do functional tasks, but also balance it out with symptom management. If they get stuck and have to act on something, talk or work through it with them until they can gradually overcome it. Provide a safe space for the client and allow them to process their thoughts and behaviors, such as with CBT, then gradually working their way out into the community. Clients with OCPD may also have comorbid conditions such as feelings of isolation, depression, anxiety, or even substance abuse. Educate and practice relaxing activities as often as possible in a manner in which the client enjoys and is intrinsically motivated with, not what you, the OT, thinks is best or what is popular out in practice. Hold them accountable with homework assignments such as stress management. If you or a loved one are struggling with OCD, OCPD, or another mental health condition, contact the Substance Abuse and Mental Health Services Administration National Helpline, or SAMHSA, at 1-800-662-4357 for information on support and treatment facilities in your area.